Welcome to our lunch and listen session, and thank you all for attending this afternoon. So the aim of our session really is to give you a safe forum to discuss any concerns or issues you may have regarding the COVID vaccination. We really want to encourage you now to ask any questions you have, no matter how small you think they are, and us and the panel will endeavour to provide you with clear answers. So we're really here to talk about the term vaccine hesitancy, which you may have heard of, but if not, really it's looking at someone's personal belief that the vaccination may be unnecessary, ineffective or unsafe, or perhaps all three. And our aim really is to tackle the reasons for this hesitancy, and it requires engagement, understanding and trust. And this is something we're extremely keen to engage with. Firstly, I'd like to introduce our panel to you today. We're very lucky we have, if I introduce Aisha to you first. So Aisha, would you like to introduce yourself?
Thank you, Siobhan. So my name is Aisha Tazara and I'm a GP in an Ipswich practice at Two Rivers Medical Centre. And I'm also Women's Health Lead for the CCG on maternity services. So I will welcome any questions. So this is the time to ask any questions you have. No question is a silly question. So please do ask. Thank you.
Thank you, Aisha. Thank you. And Lolo, would you like to introduce yourself?
I'm Lolu. I'm a GP at Burlington Road Surgery in Ipswich, and on the CCG as well. I'm leading on children and young people's work and self-care and prevention as well. And really just want to be able to answer any questions that help people feel more confident and relaxed about taking the COVID vaccine, or about any issues that you may have heard of, your myths that you've heard that you want to get addressed. We're just here really to help people feel more comfortable.
Thank you, Lolu. Okay, so what we would really like to do is really just to jump right in there and open the forum to you with any questions that you may have, or any issues, or even if you'd like to share any experiences that you have, be them negative or positive, and the panel will be really happy to answer them. So if I can come in, I'll introduce myself to you because I didn't do that. My name is Siobhan Cranjan-Arslop and I work for ISCRE, which is the Ipswich and Suffolk Council for Racial Equality. And part of my role is to work with our communities, so our BAME communities within Ipswich and East Suffolk, but we do like to open it all out to the whole of the county. And I work also in conjunction with the Ipswich and East Suffolk CCG. So this really is a partnership role where we are working in tandem with one another to support all the health needs of our communities, but also to address the health inequalities that have been brought up during the pandemic. My role is to talk with the community, talk about the issues and bring them to the table in a statutory environment, and to have these discussions. And sometimes these discussions are unwelcome, but I think that they're important conversations that need to be had. So if I can then ask, if I ask Lolu, would you be able to come in and just talk about your recent experience in the Roma community churches that you had? Sort of questions that you were asked and the explanations that you gave, that would be fantastic.
Okay, so I was recently at one of our churches in Ipswich. That's a Roma Pentecostal church, speaking to the community. And there were quite a few questions and concerns about the vaccine, and we tried to address them as the team of us who went out. I would say probably one of the questions was, one of the themes of the questions was who would we be made to take the vaccine? And that's a challenging question, in that there isn't at the moment any law that's going to make the vaccines mandatory for everybody to have. But we do know that in some, just like when you become you go into healthcare, you have to be heavily vaccinated. You have to be in the hospital. For instance, when I started training, I had to be they had to make sure I was I had the chickenpox vaccine and I had the antibodies I would be protected if I was ever exposed. So those sorts of things may well come up, but we don't, because it's so early, and this, we've only had the vaccine for 3 or 4 months now. We can't answer. We don't know all the answers to that, and I know that can be worrying. But if you think about it, protection, what the vaccine does, it is not just protecting you from COVID, but it's protecting the populations that you serve, and also your families and your loved ones and the elders around you, from the effect of what would happen if you got it and then passed it on to them. So it's thinking more about actually what is the purpose of the vaccine, what's it going to do, besides just say, well, I'm young and I'm low risk, I don't need it, but actually it's about the bigger population, the bigger, wider communities that you live in and you serve that get protected as well.
I think Jennifer has put in a question from one of you guys about what assurances do we have that BAME staff in this district working in healthcare are afforded appropriate levels of PPE equipment and assurances of its availability for them while they work. It's a very good question, and I think PPE is very important not only for BAME staff but for everyone, and it would be down to the employer to provide that. And I think it is one of the requirements for if you're caring or if you're working in primary care or hospital or in a care home, you should have been provided with appropriate PPE, which is available through NHS England. They have given lots of websites where you can directly contact and request them through the telephone. So if you are facing that issue where you have not been giving appropriate PPE, it would be good to speak to maybe your employer if they're not able to provide that, or even to, I think there's social prescribers available through Citizen Advice Bureau as well as the BAME organizations, where you can raise the concern and they would be escalated to the right bodies. So I think that's, Lolo, do you want to add something there?
I would agree with that. I have nothing else to add. I think it's important that if you're not getting the right protection to do your job safely and appropriately, and you raise that with your employer, and if they're not taking any action, that you escalate that. Yeah. Because that's at this point, we know early in the pandemic when everyone was unprepared, it was people, there were concerns about supplies, but at this point that should no longer be an issue.
Yeah, and I think just to add, now the hospitals are really well equipped, and so is primary care, and even the vaccination centres. Everyone have got adequate amount of PPE available. So I would be really disappointed if care homes have not been given that PPE, which, through my understanding, working with the INTs and care homes, they have sufficient amount of PPE available. So I think if there are any examples, please do share. So maybe we can pick it from this forum. Thank you.
Thank you, Aisha. Thank you, Lolo, for that. I just wanted to ask you both about your experiences of vaccine uptake within our BAME communities. Do you feel that there is an issue still, or do you feel that we're starting now to work very well with our communities?
I think there is definitely some reluctance, and I think we're seeing the reluctance as we are moving down the cohort. So when we were doing 60 and above, I think patients were able to take, or from BAME community, they were more actively asking or coming to the appointments for the vaccination. But as we are going to the younger population, they have got more questions, which we're here to answer. And I think females have got their own concerns around fertility and the questions. So I have seen some people just say, well, we don't want the vaccination because it would do, it would affect my long-term fertility. But looking at the data which is available at the moment, there is no evidence that it would do that. So we are encouraging people to talk to their midwives or either to the healthcare professionals for any concerns they have around vaccination, so they can make an informed decision rather than going by the myth busters, which are myths which are happening if you're on the social media. So there is, I think the reluctance is there in the younger population as compared to above 60. So yeah, I think I don't know where how Lolo feels about it, but when we did the vaccination, that's what we've come across.
I would say it's the same. That we are making some inroads. I think because we are doing more of the events like this one and the one I attended the other week, where we are going into the community to help answer questions. Making videos that can be sent around on social media and on websites like Aisha's done. We can send Aisha's video that she did recently on women's health and the vaccine and fertility and things. So I think we are starting to answer people's questions and hopefully increase vaccine confidence. But I think there is still some work to do, and so we're just hoping that we can again do as much as we can to help people feel more confident. I think one of the things that, again, just referring back to the question and answer session I went to the other week, was about well, how was the vaccine developed so quickly? Vaccines take a long time to be developed, but the COVID vaccine was developed over months. So does that mean it's not safe? Does that mean it hasn't been properly tested? And I guess the way to think about this is that because this was a worldwide problem, it was in the interest of all countries to pool resources, all their not just resources in terms of money, but resources in terms of their scientists and their medical people, to do the most that they could to get the vaccine out as quickly as possible. So many of the stages that would take months and months to happen because people were applying for funding and then being rejected, and then they'd apply again, and then also in terms of recruitment of volunteers, of people who were going to take the vaccine and be part of the trials. There were a lot more people volunteering because everybody wanted to get this vaccine developed as quickly as possible, so life could return to normal as quickly as possible. So a lot of that, those stages went by, but were done much more quickly than would be in a typical vaccine that maybe only affects a small population of people in one country, for instance, or small, or that take much longer to develop. Okay, so that I hope that helps people understand that it wasn't that the vaccination hasn't been tested properly. It's been tested on hundreds of thousands of people. And also, if you think about it as well, we've started giving it since early December. Now, millions of people, I think as of 2 Sundays ago, I think it was 20 million people that had their first dose in the UK. And even in that population, such a huge population of people, there have been very few serious adverse effects that have been noted. So I think that as well should be hopefully reassuring.
Yeah, and I think just to add to that, in Ipswich, between our practice and Barrack Lane and Every Street, I think we've done about 25 to 30,000 vaccinations, and there have been no serious side effects reported with both of the vaccines, that is the Pfizer vaccine and the AstraZeneca vaccine. So it's been really well tolerated by the older people as well as the middle-aged group. So like Lolo said, that lots of scientific work has happened, and it's deemed to be a safe vaccine, and we can't enforce. I don't think so. There will be a law that I can predict at the moment, say you have to have the vaccine. I think the choice will remain with the individual, whether they want to have it or not. But the important thing is we keep you educated about it, whatever the development is. So thank you. I think there's another question about employers being uncooperative. It's sad that they're being uncooperated, but unfortunately, if some private employers are not responding to your queries or your demands on PPE, I'm sure going to some voluntary organizations for some support would be one option that I can think of. But because they are private organizations or private employers, there's not much we can do to enforce anything on them until and unless it becomes a law that they can't really, enforce the employees to follow certain things. That's what my understanding is. I'm not an expert on HR queries, but I think that would be the simplest explanation.
We've had quite a few questions regarding employment and the vaccine, and I think for me, from working from within the community and working for a voluntary organisation, this is something that I'm going to take away and do some more research into. But as far as I know, at the moment, you can seek legal advice or legal employment advice from organisations like the Suffolk Law Centre, and as you mentioned, the Citizens Advice as well, which would be a really good starting point for that. We have also another question that I would like to pose for our GPs as well, is something that came up regarding side effects from the vaccines. There were issues that came up with opinions going more that if they had the AstraZeneca vaccine, there would be more side effects than the Pfizer vaccine, and people would have to take time off to get over the side effects, which are flu-like. As from a GP point of view, what recommendations do you have to self-medicate to ease the side effects that come through from the vaccine?
So I think, having taken the vaccine myself, the common side effects like feeling a bit tired, maybe a bit of headache, what you would need is simple paracetamol, or if you're not allergic to either paracetamol or Nurofen, simple over-the-counter medication would be enough. Again, it depends. The reaction is varied from individual to individual. I didn't have any side effects, neither did other colleagues in the practice, but some did have mild headache, which after sleeping, when they got up, it was fine. So it's variable. But going back to earlier, Siobhan, you mentioned about AstraZeneca patients reporting or having some, myths that they have more side effects than Pfizer. I haven't come across that. I think both of them have a similar side effect profile, rather than different or having a high one in one or the other. So I think simple measures, making sure you're taking rest, as well as having enough fluids, and over-the-counter paracetamol, Nurofen. 90% of the time you won't need it, and I doubt you would need any time off from work. That has not been the case that I have come across so far, whilst we've been actively vaccinating since middle of December, and the patients haven't reported that, and neither have our staff. I'll hand over to Lolu for her, just so she can share her experience.
Yep, so I've had both doses of a vaccine now, and almost a lot of my colleagues at the surgery have, and of course we have patients who've had one or two doses. I think most of our patients have only had one. I would say that people do get some side effects, and often it is quite common and relatively mild. Like Aisha said, we haven't had anyone that, so at least I can speak from a practice point of view. People have maybe needed to take some paracetamol and maybe have some have an early night, but not we haven't. Majority of our staff have not had to take a day or two off because we've had side effects from the vaccine. So, and versus AstraZeneca versus Pfizer, again, I haven't seen that there's a very different pattern between both. I think both give you the same side effects, and essentially the side effects, so the arm soreness, obviously that's from where the vaccine itself goes in, but the sort of tiredness, the headaches, essentially you can think of them as signs that the vaccine is actually doing its job, because it's helping you, your body, your immune system is recognizing that the proteins that the vaccine makes that resemble the virus are foreign and is fighting against it. So, you know, it's nothing to be alarmed about if you get side effects. And normally, you know, like Aisha said, paracetamol, ibuprofen should sort that out relatively quickly, and an early night's rest. I think I actually, for my second dose, I think I took my ibuprofen before the dose, just to make sure that it wouldn't, just like you do when you take little children to have their vaccines. You can, you give them some paracetamol even before they get a fever, just to make sure they stay comfortable. And it was perfectly fine. I went to work the next day and worked a full day on call.
Thank you both. So I'm looking through our questions, and there are a lot of HR related questions regarding performance appraisal situations that this could come up in. Is this, I'm asking now the attendees, is this something that you have come across before, or you feel that this is a potential situation that could arise? Because there's also a comment here that understandably that not all care staff work in private organisations, but they do work for the NHS. And am I right in thinking, Aisha and Lolo, that there is a staff relations department within the NHS, as well as occupational health, that supports staff with any issues they may have from an HR perspective, but also from a health perspective? From
the health perspective, definitely all NHS, not NHS, Ipswich Hospital, as well as primary care, can have access to occupational health. And they have got HR bodies within the hospital. Primary care is usually the practice managers. If you're talking about the healthcare staff, I am sure most of the healthcare staff, like nurses, healthcare assistants, are able to access some HR advice through the unions, which they are member to, and they should definitely access that. I'm not sure which particular the group of attendees, is that referring from healthcare, from NHS and primary care perspective, or is that a different group? Siobhan?
I would say it's a mixture of both.
Yeah. So I think that would be my answer from HR point of view. We are not trained in HR at all, and it would be difficult for me to advise in that respect.
Yes, and that's something obviously that we need to say, so none of us on a panel are trained in HR, but we do understand, and I understand from various conversations within the community, and not just within a healthcare setting, but also from manufacturing, from food production as well, that the vaccination has pulled up a number of questions about people's contracts, people's appraisals, and how this will affect them should they choose not to have the vaccination. So you've also there's also a comment in here that our people need support to enable them to properly consider taking the vaccine. So from your point of view, do you feel that there is something that could be done to support you with your needs, be it access to information, discussions with employers? Because from the work that we have done within the community, we have also realised that it's very important to have faith leaders support within this, and to have buy-in from our faith leaders, especially within various communities. And we've been very lucky to have that support. What we are doing within the community at the moment is looking at all areas with how we can make accessibility to the vaccine better for our communities, and that would be bringing it into the community, providing additional clinical appointments to have the vaccine. So we are aware of that, and that is something that we are addressing on a day-by-day basis as we monitor the situation.
And just to add to that, I think Ipswich and East have actually worked with the community services and have launched a community, like Lolo just reminded me about a community service, which is based in a form of bus, like a rover service, which will be going to different places within Ipswich, as well as, if needed, to other areas to just, if not for vaccination, just to answer any queries around the concerns which people might have, especially from our community, people might have around COVID vaccination. So I think the information will be available where that bus would be going through the local BAME community organisation. Is it through the BSc Multicultural Services? So it's best to contact them if you want to come and talk to a clinician about the vaccination. So it would be best to contact BSc Multicultural Services, because they would be booking, because it's by appointment at the moment, but we will expand further. So we are trying to reach out to the community in different ways. I know on one of the Fridays, the bus would be going to the local mosques just to answer questions for people from who are visiting the mosque. So we are reaching out to people who might not be coming to the practices or are too busy in the day job. So having a bus there might answer some queries. So I would say contact BSc Multicultural Services, because they have lots of information on where the bus is going to be.
He says, unfortunately, there is a mistrust and fear associated with the vaccine by certain parts of BAME, and these fears are not necessarily from the Mythbusters. I believe for some members of the BAME community, it is a wait and see stance if they have the opportunity to wait for as long as they can before considering taking the vaccine. For others, the more members of the BAME community that take it, the likelihood they will take it. But the overall concern for most is around fertility and other perceived health conditions that could arise from having the vaccination.
I think understandably, we understand these concerns. But because I had to do this video for fertility, so I looked into the data which was available, and there is no mechanism by which the vaccine can affect women's fertility, or for that even males' fertility, because the vaccine works in a very different way to create antibodies to protect us from COVID-19. So I think being a doctor and looking at the research which has been produced so far, it's difficult for me to understand how it would do. So I think that is, I would say we shouldn't definitely believe in that until there is more data available. But what I have studied and researched, there is no way both of the COVID-19 vaccines or the incoming vaccines like Moderna, I think there might be others, can affect the women's fertility in any way. And similarly in pregnancy and breastfeeding, it is safe to have it in pregnancy, especially if you are from our community and working in healthcare sector, as well as social care, where you're having lots of face-to-face meetings with clients and patients, vaccine to have. And I will pass to Lolu, because I'm sure Lolu has done some research as well.
Well, what I would say, I think, is that not so much from the research point of view, because my research has the same conclusions as Aisha's, but not to be a prophet of doom, but there is some danger in the wait and see approach. And for especially considering the information that we do have from the last year, that people in the BAME community who do contract COVID-19 are more likely to have to be seriously affected, and more likely, unfortunately, to die from a COVID infection. And the wait and see approach, unfortunately, will mean that could leave people vulnerable and unprotected, not just necessarily individuals, like I said earlier. It can make your family and your community vulnerable and unprotected from the virus. And I understand that, because I actually, as a human being, as an individual, take up my medical training, I am a naturally risk-averse person. And it is, you know, I would like to see what happens to everybody else first. I mean, I don't know if you sometimes see the curve where you see something new comes in, and there's some people who are sort of the early adopters and rush to get it, like the new iPhone 12. People who queue outside, or 13, whichever one's coming next. People queue outside and are waiting to be the very first to get it and want to, you know, and there are other people who sort of just wait and hang out to say, well, let's see what everybody else, let other people develop, you know, let other people find out what the faults might be or what might go wrong before they jump in. And so they might be on the other end of the curve. And I'm often on that other half of the curve, waiting to see what happens. But in this instance, even though I had many of the same concerns and questions, a lot of that I'm now answering for other people. I did the research, got the questions answered, and I said I can't afford to be a late adopter for this vaccine because I've got young children at home. I have older relatives that live with me. I can't afford to. I've got patients who I will be exposed to, and God forbid I get the virus and I'm asymptomatic, and I could be spreading it all over my practice, spreading it to my patients. And I think it's that those were the even less for my protection, but more for the protection of my community that made me say, actually, yes, I have some questions. I've got them answered, and I'm going to, you know, take a bit of a leap of faith here, and I don't know every single answer to every single question, but that's the same for many things that we do in medicine. We know a lot about a lot, and in some bits of medicine is a bit of art. A lot of it is science, but some of it is a little bit of faith, a little bit of, okay, you know, the research shows this, but each body is an individual. You know, somebody else has had this before and they've gotten better. I'm going to believe that I will take it and I will feel better. And I think with the vaccine, as much as we would like to know every last thing about it and tick every, you know, dot every I and tick, you know, cross every T before we take it, I think from being from the communities that we are, knowing what we know already, that is definitely sure. We know the research shows that this is what's happened all across the world, in the US and here, that our communities do not fare as well. But with this vaccine, it is quite a risk to say wait and see what happens, and then we end up in another wave, God forbid, in the winter, and communities are still unprotected.
Thank you, Lolo. I have a question to you both. So, is that, do you see from your professional point of view that we could be at risk of another outbreak should vaccine uptake fail?
I think we haven't got a crystal ball to predict what may happen, but that is what has happened the second wave. That, you know, there were people, once we started meeting each other or going out to the supermarkets or the towns, it just spread. But I think looking at the data again, since the vaccination has started, it looks that the hospital admissions are going down. So this vaccine is providing some kind of immunity to the cohorts and protecting us all. I would encourage everyone to have the vaccine, and all we can do is encourage. We can't force anyone, and that is not our place to do. So I would say, if you have any questions, please ask us now, or, you know, any concerns, so we can at least answer those questions to help you make that decision whether you want it or not. But I would actually request all my patients. I always say to them, if they ask me, should we have the vaccination? And the answer is, if I was you, I would say yes, have the vaccination. I've had the vaccination to protect myself and my patients and my family, like Lolu said. So it's important everyone thinks not only about themselves. They might be 20, 25, might not get enough side effects, but they might give it to someone who might be vulnerable. So it's also to protect them as well. I can't really predict, Siobhan, there will be another outbreak or not, but anything can happen. We never predicted that we'll be hit by something like COVID.
Absolutely, absolutely. I think it's something that none of us saw coming. So what would you say to individuals who are taking the stance around herd immunity? Is that a safe way to look at the pandemic at the moment?
I think the lessons we've learned in the last 12 months and exactly a year from now, probably maybe a few weeks more, this was the discussion that was having nationally, you know, herd immunity is the way that's going to protect. And a year later, we know that that didn't work, but having some kind of immunity developing through vaccination might protect us. And again, the evidence and the data is not there at the moment. But I would say that the more people are vaccinated, the more people, the protection is there out in the community, as well as reducing, if someone does get, who's not had the vaccine, COVID-19, at least, you know, someone who's had the vaccination and unfortunately they still get, after the first dose, have not had the full course of the vaccine, it still reduces their chances to be admitted or having a severe illness from COVID-19. So yes, I think to some extent we're heading in the right direction. But the important thing is we're all in it together. So if only 50% of the community has it and 50% doesn't, then I think we're leaving people vulnerable.
Brilliant, thank you. We do have a question which actually leads into this. Someone has added, what makes you think they have our best interests at heart?
I think that that's a difficult one, but I like to believe in the good of humanity. Maybe I'm naive. And I don't see why they would not have our best interest at heart. Just speaking from a purely individual, personal point of view, if all the care workers and healthcare professionals were all or a good number of us were to be incapacitated by COVID, so whether we got seriously ill and couldn't work or actually succumbed to COVID, the health and care system will be on its knees. So yes, maybe they're thinking about the wider system and not about us individually, but I would think that actually it's in the best interest of the government and whoever else they might be, that we are protected and that we are safe and our communities are kept safe, because then it affects our ability to contribute to society and to contribute to health and care of the population, which is the government's job.
And there is just a comment that I think the they refers to the pharmaceutical companies like Pfizer and AstraZeneca. Well, at the end of the day, Pfizer, AstraZeneca, Moderna, whoever else are all commercial companies. So we can't ignore the fact that they're not charities. They're not necessarily there for yes, they want to see COVID defeated and all the rest and levels brought down to normal, but they are companies with shareholders and they want to make a profit. Now, does that mean that they're giving us a rubbish vaccine? That will not do their companies any good, because then we will find out the vaccine doesn't work, and they will their reputation and their research on all the things that they do will be affected by the fact that they produce something that doesn't work and has put people at risk. So yes, yes, we can't ignore the fact that they will have a financial or commercial interest. There's no doubt about that. But equally, and not just them, the governments that have donated and to the work to make the research go as quick as possible, they have the interest of the world really, because if COVID doesn't, if the levels of COVID do not get suppressed to the point where we can resume life as close to normal as it used to be, it affects whole economies, and they operate within a big economic system, not just into the individual pockets. That the fact the economies are crippled at the moment affects them as well. So they've got lots of interests, I'm sure, that they're juggling, but I'm sure they do have the interests, our interests at heart as well. If there aren't any more questions, if we close the question and answer session for now, What I would really like to do, though, is to, if you want to unanonymize yourself, that's it's completely your choice, but I will go back and do some have some conversations about the HR element surrounding the vaccination and employment law as well. I'll be really happy to look into that, because I am sure that this is something that will come up now again and again. So I'm very happy to do that and look into that and come back to you all regarding that. So really, I want to thank you all for taking your lunch break and attending this early afternoon. Aisha and Lolu, thank you so much as well for answering the questions. And I just want to quickly go over some things that Aisha talked about as well. So the Ipswich and Suffolk CCG, as was mentioned, have a new project called the Vaccination Bus. And this bus will be going into the community to deliver the vaccine within individual areas within the community where people feel comfortable taking it. But also it provides a provision where each individual gets 15 minutes to talk with a professional about any concerns or issues they have regarding the vaccine, but also any other issues that may come out. If you have any health issues, any socioeconomic issues that may be affecting you, there is domestic abuse support there, and there is also women's health support as well. So those are things that we would like you to utilise if you would like to, because the provision only is there if it's used. Also, we've been in partnership with vaccination clinics within the community. So recently we had a session a couple of Sundays ago at Gainsborough Sports Hall in Ipswich, where we had over 200 vaccination slots open to our BAME communities. And the really great thing about that was every single slot was taken, and we had a backlog of people on the waiting list. So we're hoping to open more of those up in the meantime.